This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Morning and welcome to the first live show in several weeks.
We're happy to be here, John.
We certainly are, because it's been a couple of weeks. And
the gremlins had worked around us. Yeah.
We were not sick.
No.
We were not on vacation.
Right.
And it was basically technical difficulties.
Correct. And
for a couple of weeks, and we finally solved them. And now here we are live.
And I hope our listeners are listening, and if they want to call in and give us a little heck over it, please do.
Yes, we did receive a lot of flack.
We did. We really did.
People were saying, are you guys sick or what?
No.
Well, good morning and welcome to another live edition of Health Watch every Sunday 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will talk today on the show about the who, what, when, where, why, and how of Innovative Medical Associates, how it can help you and your family, potentially, and anyone you know, improve your overall quality of life. And we will certainly talk about that today here on the show. 855-839-1210 is the number. And we know that maybe you've had some weeks where
they felt withdrawal.
That's right. So maybe you want to call in. 855-839-1210 is our number here in the studio. And, yeah, we are happy to be back.
Hey, John, I want to modify that. I felt withdrawal from the listeners.
Yes,
yeah.
Yes. We both did.
Yes.
Yeah. But we were walking into the clinic. You guys all right? Or what is... So tell us, what is the philosophy? What is Innovative Medical Associates all about?
Well, one of the things, John, is that we are a group of like-minded healthcare providers who can do anything that a normal primary care facility can do. They all work out of our facility in Marlton, New Jersey. And the key to this is if you need a prescription, you're going to get it. If you need radiology, we're going to send you out. You need laboratory, we have it right there. Anything you can normally do in a primary care, or your old GP, if you remember that in the old days with the black bag, can do, we can do. It's our philosophy, though, that sets us apart. We believe in using as many natural products to augment pharmaceuticals, using the least amount of pharmaceuticals that we can to effectuate the change of the medical challenge for a patient. And in that case, we actually believe that certain nutraceuticals, and we know them and we have them, and we utilize them through hydration therapy. Why hydration? Because it's the most direct way to deliver.
Yes, I know, and I've been doing it for 20 years.
You have, and you look great.
That's
so
right.
That's why nobody said, is John sick? I said, put that out of your mind.
So what types of substances or ingredients do you use in replacing
vitamins, minerals? And again, John, I don't want to use the term replace. I would rather use the term augment. Because many times what we can do is help patients cut down on their medication. It really depends on the severity of the condition. Has it been a long-term condition? If you have hypertension, we've got to make sure that blood pressure gets under control. If you have high cholesterol, we've got to make sure that we bring down the cholesterol and improve your good cholesterol, right? So there are many ways to do this, hydration being the best, utilizing things like vitamin, minerals, amino acids, the kinds of things you might find in the health food store, only we want to use them correctly.
Well, we already have a call.
Oh, good.
And it's our favorite, Frank from the Northeast. Frank, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Oh, Frank, I'm glad to hear from you here.
So, Mike, you won't believe what happened. The paddles were next to my couch and the bed, okay?
Oh, no.
There's an old saying in the hospital, Dr. Molly, VFib, defib. Now they added, no, Dr. Molly, defib immediately.
Oh, gosh. Thank you, Frank.
Dr. Molly, I'm going to stay on this issue for a second here.
Sure.
2 weeks, no big deal. Third, fourth, I don't know how long, man. I was going through severe withdrawals. I was shaking like a leaf on a tree.
Oh, Frank, you're the best. You are the
No,
best.
seriously, welcome back.
Thank you.
Welcome back,
Thank-
Tyler, Dr. Molly, and John.
Thank
I just want
you.
to be getting there and just let you know, I did miss you. I understood there was problems with the system. That happens, but it's nice to be back again, Dr. Molly. Take care and have a great day, okay? Thanks.
You too,
Hey,
Frank,
hey,
and
Frank,
thanks for
thank
the
you.
call.
Thank you, Frank.
And
God bless you.
Believe me, we were as frustrated as the audience was
Yeah.
because we couldn't get on.
All right.
But that's another story for another day. So we were continuing
Sure.
about
So vitamins, minerals, amino acids, the kind of things you might get in a health food store. However, I believe our delivery system is superior to what you would do in the health food store. And more than that, I think the advice we're going to give you is more superior. So the utilization of these things can absolutely help a patient reduce their medication, thereby what? Reducing the side effects from the medication alone.
And when you get the hydration and it's direct into your body,
Sure.
what is you can't say exactly what's in it, but
Well, things, innocuous things like vitamin C.
Yeah.
But again, I'm going to tell people, it's not just vitamin C. Yes, vitamin C is ascorbic acid, but what we want to do is utilize vitamin C that's appropriate. Half the time what happens in the health food store, you go in, you look at the bottle, you see I'm getting 500 milligrams of vitamin C. You don't know what the extract is. You don't know if it was manufactured vitamin C. You don't know if it's going to be absorbed by the body. Yes, you can go in and after being around a little bit, being around the block, it's liposomal is what you want. But there again, you want to use brands that are appropriate for you. So in coming to our facility, you are going to get the nutraceuticals you need in the ratio you need that's appropriate for what we have to do. The other thing is, how many people go into the health food store and they just talk to the clerk? Lots of health food stores. And by the way, I tell people go to the health food store. You've heard me.
Yes.
We've sent you. Yeah. So the bottom line is we love our health food store folks, but many times they go in and you're overwhelmed because in that aisle you might have 100 things that may help the blood pressure.
Absolutely. And I've done that many times, and I do what you tell me. Ask
Right.
for the specific thing.
Right.
And only get that.
That's
Don't
right.
pick out.
Don't pick out 10 other things. And the problem is, I see people come into me, they have bags and bags of nutraceuticals. My people from out of town, my God, they brought me more nutraceuticals, more herbal medicines. Half of the herbal medicines were negating the nutraceutical medicine. The other half were taking these amino acids that had nothing to do with why they were here. And it can be insane. So I want people to understand when I'm going through the clinic, we're giving advice as well. And
Right.
we want to
That's
tell
right.
people, utilize things that are necessary for you. And again, John, I want to say, not too much, not too little. How about people? We want to know your allergies. How many people go into the health food store and they find out they're allergic, let's say, to onions, and they don't know that maybe that quercetin was extracted from onion? You know how many? Too many to count.
It goes to show you, don't go into the health food store without some advice.
I agree with that. Or go to a place where you're getting advice. Maybe they have a naturopathic physician there. Maybe they have a nutritionist. And then bring the stuff in. We'll talk to you and see how we can weave it into your protocol. I'm not against oral products. In fact, we believe in them, but you want to use them properly.
We are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, 855-839-1210. Yes, we are back and we are live, 855-839-1210. That's the number. You have a question, you have a medical challenge that you want to run by Dr. Molly, feel free to call in. Again, 855-839-1210. We're coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and operators standing by at Innovative Medical Associates. And remember, They're always there when we're here. In fact, they're here when we're not. They're going to be here all day today. They don't watch the Eagles game. They just take your phone calls. 856-489-0505 is the number. 856-489-0505. And when you call, probably the best thing you can do is to schedule the initial consultation with Dr. Molly. It is complimentary, doesn't cost you anything, and you will learn a lot about what she does and what she can potentially do to help you. It's very, very simple. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones right now and talk to Heather in Bucks County. Heather, good morning. You're on with Dr. Molly.
Hi, Heather. How are you?
I've been better.
I don't like the way that sounds. Come on.
Yeah, I've been better. The reason I'm calling, for the past couple of years, I've been having like digestive issues.
Sure. Okay.
You know, like bloating after I eat, constipation. I mean, I've been to GI doctors. You know, I've been to every doctor there is, and you know, they give you a pill, they send you on your way.
Right.
And, you know, nothing seems to be working, and it's uncomfortable. And
Heather, how old are you? Can I ask that question? How old are you?
I'm 54.
You are a baby. Okay. Ooh. All right. Okay.
Yeah.
Yeah. Not that old. Yeah. I mean,
no, definitely not. Okay. Yeah. So when you say your digestive issues, obviously you've been to the GI guy, so they have already ruled out anything significant, right? In other words, you don't have a peptic ulcer, you don't have ulcers of any kind, you don't have GI cancers of any kind, right?
Well, the only thing they've done is X-rays, and they've said, well, you're constipated. Here's Lindex and Motegrity, this, that, and the other thing.
Okay.
Stuff doesn't really work. No endoscopy, and this was a while ago, so I haven't been back since. I mean, it's been about probably a year.
Okay. Well,
and then what happens is...
Here's the thing. I think you definitely should be checked out completely, though, too. You know what I mean? I mean, the tests that you've had seem to be, ordinary. You might need a full GI series, and you might need a colonoscopy. But all of that being said, we subscribe to the school of thought that the brain is in the little gut. The gut is the little brain. So there's a neuroendocrine relationship that's really, really important. And it's interesting you tuned in today, because I'm going to be talking a little bit about our philosophy in terms of this. So a couple of things I would do. First, I would do is a very simple thing. I would go out and get some aloe, which is like George's aloe. It's the clear aloe. I don't have any money in the company, no stock, none of that. Yeah. It's just I believe in it, and it seems to help a lot of people. Half an ounce in the morning, half an ounce at night. But again, that's not the only thing. If you were our patient, I probably would discuss this with Dr. Kaska. We would probably order several types of blood tests, including looking for things like cytokine panels, which I'll talk about a little later, because I want to know if this is an autoimmune response you're having, and it may be triggered by something you don't even know. So, and in that case, I would say that hydration therapy would work for you because of the manner in which we would get delivery. So this is a great call, and I wish you a lot of luck with this, but I'm telling you, get yourself checked out or come on over and see us, okay? God bless you.
I mean, what do you think about digestive enzymes?
I love them. Love them. Love probiotics. There's a whole mess of things I would be doing. This is too short of a period of time to talk about it, but definitely that's all part and parcel of the hydration therapy. But I'm going to tell you, you probably do need a short course of hydration therapy that could help re-regulate anything that is going on, along with making sure you're getting the right probiotics, the right digestive enzymes, and several other things. Okay?
Yeah,
You're
Heather,
nice lady.
I may suggest calling the operators right now or after the show and schedule that initial consultation.
It's free, and I'd love to see your
You're going to learn a lot from that, and I would wish you the best.
God bless you, Heather.
Thank you, and thank you for the call. Thank you. Appreciate it. 855-839-1210 is our number here in the studio. Health Watch every Sunday.
John, another thing I would like to say to her, it's very important to see where her hormone panel is too, because there's endocrine issues with that. Anyway.
There's definitely things that you can do immediately
exactly.
to try to help the situation. Again, 855-839-1210 is the number. Dr. Molly, you're going to talk about physically re-regulated medicine.
Close enough.
And cytokines etc.
It's physiological regulating medicine. And it's born from molecular biology, the emerging science of a molecular biology, biochemistry, and new advances in medicine. And the reason why I want to talk about this is the paradigm that we have used for 20 out of my 27 years. And the reason being, obviously, it resonates with me, but I'm lucky enough to have Dr. Pat, along with my other doctor, Dr. Linda, and my wonderful nurses, who really try. Well, if you're working with me, you're going to get some kind of primer in biochemistry and in molecular signaling in terms of the body. So yes, this is what we believe, because the philosophy of that is we want to bring you back to homeostasis. In other words, whatever your challenge is, our mission is to figure out what the signaling issues are. And there are lots of things that are controlled by peptides and interleukins and cytokines, which I am going to talk about today. But this paradigm means it regulates the signaling that the body does from top to bottom. And it has to be just right. When I'm always talking about Goldilocks, John, that's what I'm talking about. To bring the body back to homeostasis, to get it out of sickness or disease or challenges, medical challenges, and bring you back to a state of balance. And that's what physical, or actually physiological regulating medicine is all about. And one of the things that I concentrate on are these particular substances called cytokines, and we really look at cytokines a lot, because cytokines are a production of chemicals that actually they're peptides. And what happens is they're in control. They are the signaling proteins that help control inflammation in your body. And you know what I say about inflammation.
Yes.
What? It's the devil.
That's right.
And so they allow the immune system, among other things, to mount the defense if, let's say, germs, bacteria, viruses, or toxins enter your body. Too many cytokines can lead to excess, and too little cytokines can also cause a problem because you won't respond to an illness. For example, we've had that problem with what? COVID-19, right?
Yeah.
COVID was a big deal about utilizing our cytokines. Anyway, so they are the chemical messengers in the body, and they resonate, okay? They work together to protect the body from the viruses, etc. So even when there's no threat, the cytokines send signals to keep your immune system functioning. Now, let me say something. A lot of medicine, a lot of medical data is coming out on this, even though it's a molecular biology kind of initial review. It was molecular biology that looked, this is how science and medicine can actually go working hand in hand, because these signalings keep your immune function working properly. And think about this. What do you think immunotherapies are doing? They're working on the signaling pathways, folks. They're working on the signaling pathways. And bringing us to this, I have a very interesting story this week that happened in my clinic, right? I have a patient who's undergoing cancer treatments at a very renowned university. I get a call. They want to have my protocol. Well, I'm not inclined to give them my protocol unless they sign the do not disclose and the confidentiality statements. But I said I'll helpfully give you a list of many of the nutraceuticals I might use on this patient. And I gave him a list of what I have in-house, and I have plenty, John. You know that.
Yes.
I have a lot of nutraceuticals, particularly the anti-inflammatories, etc. In the whole list I gave them, the particular list that I would use on this particular patient for her particular cancer, only one item was a problem in that particular recipe. And of course, this is why I ask patients to please bring me any type of the chemotherapy they're getting, any type of the immunotherapy. I need to know the names so that we can make sure that we are here to support your cancer journey, not to cause a problem in it.
And with that, we are coming up on a break. It is the halfway point of the show. And as we always say, time flies when you're having fun. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. That's 855-839-1210. Feel free to call if you have a medical challenge you want to run by Dr. Molly, or just a simple question, 855-839-1210. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates, 856-489-0505. That's the number, 856-489-0505. When you call, the thing that you want to do most is schedule that initial appointment with Dr. Molly. It is complimentary, it doesn't cost you anything, and you will learn a lot about Innovative Medical Associates, what they can potentially do for you, and how they can help you. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. The number here in the studio right now, you want to call in with a question or a thought for Dr. Molly, 855-839-1210. We're going to pick up the discussion of cytokines.
Right.
And again, this is very important because it's all related to other things.
It sure is. Cytokines are the messengers, okay? And the thing is, anti-inflammatory cytokines stop or lessen inflammation. They relay messages to the cells that prevent excessive immune response, okay? That can lead to the tissue damage. So we need to think about this. But stopping the body's inflammation response is just as important. So it's what I'm saying. It's like Goldilocks. It's got to be just right. Otherwise, inflammation, too much inflammation can be unpleasant. Too little can make the body have a disease state. So this is the thing. But how did cytokines work? Well, this is the beauty of this. If you think of cytokines as a protein, as a key, and the cells have receptors on the cells like a lock, the cytokines that are being released enter the receptor, the lock, and the receiving cell receives a message. So you can see that messaging is so important, and that's the thing. That's what physiology does. It's going on every day, right? We have a Krebs cycle. This is the thing that I laugh about, and if you see it, it's quite complex. But every day, the cells are receiving messages that tell it what to do. And the cell acts based on the messages it receives. So, for example, an immune cell may detect a harmful substance like a virus. That's what happened with COVID-19, and release cytokines in response. The cytokines travel through the bloodstream directly to the tissue, which might be the lung tissue in this case, right? And until they reach the cell with the matching receptor. So you can see it's a complex thing. God did a wonderful thing putting this body together. Can you imagine? It's like an engine working all day,
Yes.
from the time we're born till the time we take our last breath. Okay? The matching receptor. The receiving cell receives instructions and acts on them. So we hope that the receiving cell receives a signal that says, hey, kill this thing. But sometimes it goes haywire, right? Sometimes it goes haywire. And then we have other issues. And this is why cytokines are so important. The difference between pro-inflammatory and anti-inflammatory cytokines are so important. And this is the wonderful thing about what we do at Innovative Medicine. We think about this process every day for every patient. In other words, you just don't slap nutraceuticals on a patient and say, okay, here's your drunk tank thing today, okay? Nah, it doesn't work like that. Yes, we know vitamin C helps the cytokines to help maybe your headache. We know we can give you something for the nausea. But what we're thinking about is the interplay of these cytokines and things like interleukins. Interleukins got their name from inter, which means between the leukocytes, the white blood cells. White blood cells are leukocytes. We've heard this a million times. Originally, back when I studied this initially, I can't tell you how many years ago, folks, we thought that the leukocytes alone released the interleukins and only relayed messages to other interleukins. But now we found they relay messages between the cells that aren't leukocytes. So you can see this kind of thing, worrying about cytokines and leukocytes and interleukins are so important, because this is the basis for a lot of immunotherapies that are going on right now to aid cancer patients. So obviously, we don't want to give a patient who's going through a cancer treatment protocol anything that may interrupt what the treatment protocol is doing. It's not just killing the cells, but it's trying to really do something by cutting off the rogue signaling. We don't want to do that. We want to help you get through this process without making it too difficult for you. And this is why this is so important. There's another thing we look at, TNF, and people will see this all the time, tumor necrosis factor. That helps regulate the inflammation in your body. It signals the immune cells to kill the tumor cells. So we don't want to do anything that might impede the traditional thing that's working on this, but we know we can help you get through it with some nutrients and natural substance that might aid this in doing just that, in killing the tumor cells.
Let me ask you this.
Yes, go ahead. I hope this is simple enough.
The use of hydration.
Yes.
What is the relationship between the cytokines and the hydration? In other words, are cytokines in the hydration?
No,
Okay.
cytokines aren't in our hydration, although we have used interleukins, I will tell you that, very, very low doses. But when you look at this, you need to know this is the basis for all of what's going on in the body when the patient presents. What is going on? You present with a particular cancer. What's going on with those cells? Why did those cells get mixed messages? It's the cytokines and the interleukins that might have given them bad messaging. And what we want to do is we know, and they're doing more and more of this. They know that there are drugs out there that can sort of cut that signaling, the bad signaling. And those are the new immunotherapies that are out. Okay?
Okay.
But what we want to do is I want to show people that this has been done for years. It's done in Europe for years by using repurposed medication in a lower dose. You've heard me talk about that. We use that in our IV treatments. Right?
Yes.
We use lower dose proteins that we might want to use for a patient to help a patient get through their particular problem. And there are many, many nutraceuticals. In fact, over 150 pages of nutraceuticals in Science Digest just recently that really can help these signaling molecules do their job. So many times people realize they go to these cancer centers and they're making drugs, right, from them using their own cells by looking at these cytokines and interleukins.
A fascinating
And I can
discussion.
go on and on, but the idea is there are natural products that can help patients regardless of their challenge.
And we are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge that you want to run by Dr. Molly. 855-839-1210. That's our number here in the studio, 855-839-1210. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Dr. Molly and I will return with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. 856-489-0505 is the number, 856-489-0505. When you call, remember, all you have to do is schedule that initial consultation with Dr. Molly. It is complimentary, and you will learn a lot about what she can do for you or potentially do for you or anyone that you know. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. If you want to call in, we still have time left on the program. 855-839-1210 is the number here in the studio, 855-839-1210. This is the portion of the show where we like to talk about some patients and their progress, and we have a lot of them today.
No, we do, John. Okay.
Starting with the rheumatoid arthritis patient.
Our Sandy, yeah.
Yes.
Sandy's the one who stands out because she's been with me for quite a while. And the thing is, so Sandy just got herself another rheumatologist, a new rheumatologist, who understands that she is doing the natural products as well. Now, the idea is Sandy's been put on a couple of medications that I think are going to help her. Some of the biologics do exactly what I'm talking about with the cytokines. So, obviously, when we put together Sandy's recipe, since she's been on these new medications, we had to review these. Dr. Kaska and myself reviewed these and said, okay, what do we need to do? What anti-inflammatory should we be giving Sandy to aid these particular drugs in helping her maintain her quality of life and allowing this maybe to go a little longer between traditional or conventional treatments. And that's the kind of protocol that we put together in terms of the anti-inflammatories. So she said this week, we just started her on a new group of protocol, and I believe this week she said she was feeling quite a bit better. And she, I want to say that our job is to enhance the conventional. If a patient in our facility wants to do a conventional treatment, we don't say don't do it. We say go ahead. We want to meet the patient where they are. I have a patient, Pam, who's been with me quite a while, who had a cancer. She didn't want to do any conventional treatment, none. But in her case, what I'm responsible for maintaining, now she has to do her part in maintaining her health, which she does, leads a clean diet, etc. But we have a responsibility to give her anything we can that we know works on these cytokines and these interleukins, the play, to make sure and help her not get this cancer back. You see the relevance to what I'm saying, John?
Yeah, yes.
Yeah.
So back to Sandy. So is she going to continue with treatment?
Well, she's continuing with treatment with us. I'm hoping that we can cut down her visits to the rheumatology. In other words, instead of going in for the biologics, because they have a lot of side effects too. They're not using low-dose biologics, okay? So what we want to do is make sure she's getting an appropriate dose of the biologic, help her in that regard, and maybe stretch the time out. So instead of going once every 4 weeks, maybe she can go once every 3 months. And that's the ultimate goal, so that we can reduce the side effects from the biologics.
And that's really your goal with pretty
everything.
Much all your patients.
That's exactly
right.
Okay.
Okay. We also have, and I know this patient, Joan, the cancer patient.
Yeah, she had mets to the brain. And, of course, unfortunately, she had, by the way, she looks fabulous. She doesn't miss a week if she can help it. And she travels quite a distance to come to us.
An hour and a half.
Over an hour and a half. So because I had a nice relationship with her radiologist, which I really appreciate, he was very kind and really wanted to understand a little more about what we did. She's now getting ablation on the liver because she had a couple of spots there. And really, we encouraged her to do that because overall her health is maintaining and her quality of life is maintaining. She had a little more fatigue this week, but overall she's doing really well. And I expect the ablation to be a success. And I think that her quality of life, given where she is in her cancer journey, is a testament to how we do the hydration.
And we also want to talk about, I love this one. I have a touch of diabetes.
Oh, my goodness.
And that's like saying, I think I'm half pregnant.
John, I am so upset. A whole family came in from out of town. It was mom, dad, and grandmom and grandpop, came in. So, their children have children. So the question became, they all had hemoglobin A1Cs above 6. None of them were taking any type of medications for the diabetes, which, we have to get that blood sugar down. It's dastardly. And if you think about how large the blood sugar molecule is, right, and how small our red blood cells are compared to that, can you imagine why you have all kinds of things like neuropathy, that you can lose limbs, you have gangrene if there's an infection? I mean, it's a terrible, terrible condition. So what we had to do is sit them down, look at the hemoglobin A1C, take a good medical history. Dr. Kasica put them on an anti-diabetic medication, not a whole lot, and then also gave them, we needed to give them the diet to go home on, which is low glycemic, right? We want them on low blood sugar. And by the time they left, we got the fasting blood sugar down from like 150. Some of them had blood sugars in the 200s. We got them down to around the 90 or 100, which is a big drop in a short period of time, 4 weeks, less than a month. And I will tell you that I'm hoping that they go home, stay on the diet, and that their primary care doctor sees what we did and helps them. If not, we are going to renew the medication from here.
These are not old people. These are young people.
Young
right?
people. Grandpop was in his 60s and the son was in his 40s. So you know what I'm talking about. This is crazy. You can't listen. There's no such thing, folks, as a touch of diabetes. You have diabetes, please take care of it. The other thing I worry about is the loss of limbs because they can't get enough blood flow from head to toe because pushing that sugar molecule around is tough. It's like us trying to push it with a Volkswagen, pushing a semi truck. You know what I'm saying? Yeah. You just can't do it, folks. And that impedes your circulation to the extremities. That's the worry. These people are hardworking people. They need to have good mobility.
What did you do to get them down to?
Well, first thing we did was we encouraged them to follow low glycemic index, and we gave them a list of what things they should eat. When you find out that they're eating all types of starches till you want to kill yourself, you know that people, you're just killing yourself, folks. And we explained it to them. They need to get on some things that'll really help lower the blood sugar, alpha lipoic acid. We also needed to take into consideration, did they need some blood pressure medication as well? And we decided at that point, Dr. Kasica decided, yes, put them on a small amount of blood pressure meds to help regulate the blood pressure, and that in and of itself. And the nutritional IVs that we gave them, we were very cognizant of the fact that we want the extractions to be of low glycemic nature. For example, I don't want to extract vitamin C for them from oranges or tangerines. I want to extract that from tapioca or cassava. And in that case, that's exactly what we did. So you need to look at the entire process.
Any other patients?
Oh, yeah.
Quickly, we got a couple minutes left.
I had a young man who we sent home post-concussion, and that was very interesting. The concussion happened over a year ago, and the healthcare provider they were going to said, just don't worry about it, keep him 48 hours down, and that's the end of it. Well, as a matter of fact, Dr. Kasica examined the boy, and she said, look at his eye movements, etc., there's a problem. So we called in a physical therapist who knows post-concussion syndrome. She worked with the patient. We, in turn, gave the patient a lot of nutraceuticals. He actually came to us because they thought he had depression. And indeed, part of the post-concussion symptomatology can be like a depression, and he was also having racing thoughts. So this is a great case, and I think we help improve that young man's life.
You know, we know from the NFL about concussions and how serious they can be.
Terrible.
And this was another case where they just kind of sloughed it off.
Yeah, you
and
can't
really,
do it because he was a young kid. But you can't do that, folks. When your kid gets hit in the head or whatever, you got to make sure that you not only follow a quick remedy, the post-concussion remedy, but you follow up with some people. And I'm telling you, this was a great case.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by, and they will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. You can call them at 856-489-0505. Again, the number 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel, and then, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday, 8 o'clock, Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.